This is CBS 2 News at 5.
Hospitals across the tri-state are starting to feel the strain of the so-called triple-demic.
It's being fueled by an extreme spike in cases of RSV among children. CBS 2's Jessica Moore spoke with experts about the impact of the virus and what parents need to know.
3 months old, coming in, congestion, the color is off. The lips aren't as bright as they should be. The patient isn't eating, isn't drinking.
ER nurse Karen Fountain has treated more than 100 children with RSV. Now she faces the daunting task of placing nurses at hospitals across New York City.
They need more pediatric nurses, especially PICU nurses, which take the higher acuity, which we're seeing from RSV. 100% increase in the need for pediatric nurses in the last month alone, and we haven't even hit flu season yet.
According to the CDC, there were more than 7,300 RSV cases the week of October 15th, more than double from a month earlier and the most seen in 2 years. The Department of Health and Human Services reports 3/4 of the nation's pediatric hospital beds are filled, marking a 2-year high. Making matters worse, the triple-demic caused by rising cases of RSV, flu, and COVID. Dr. Bruce Y. Lee says viruses like RSV were mostly avoided for the past 2 years because of strict COVID precautions, many of which are now gone.
Can having the flu or COVID trigger RSV, or is that a misconception?
Well, there's situations where you can be infected by multiple pathogens at once. And the challenge is when your immune system is busy fighting one pathogen, it's less able to fight against another one.
Experts say parents should get children vaccinated against flu and COVID, make sure they wash hands frequently and thoroughly, and avoid people who are sick.
But even amongst young children, you're talking about 1 to 2 out of 100 people who get infected that might require hospitalization.
Do you foresee a time where we revert back to the early days of COVID when hospitals were at max capacity, but this time we're talking about children's hospitals?
That is a concern, and we're already hearing reports of hospitals reaching close to capacity, so it could very well happen, yes.
Doctors say when in doubt, take your child to the emergency room, where most are treated and released in a few days. Jessica Moore, CBS 2 News.